My name is Tara Talbot, student number T007-45663. My clinic mentor, Jen, and my other assistant, Chrissy. So she's gonna be holding the head while she holds off on the vein. So she's occluding the right hind leg already for me on the lateral saphenous vein. So I have a 3 mil syringe here and a 23 gauge butterfly. I'm gonna use to draw blood. So I'm gonna clip a bit of hair just because we are really fluffy.
Okay, I'm gonna have to.
So we're flipping him to lateral because he's an old man and he was going down. So anyway, I am gonna clip. I'm just feeling for it so that I don't clip excessively. Just at least shave a little bit of his hair. That's nice. Get a good visual. And with alcohol. I'm just trying. He has old man veins, and it's cold. Just saturating because he has thick fur, so we can see the vein there. So it helped to visualize, but it also disinfects the area. So I'm going to be going in at a 45-degree angle with my bevel up. I'm using my left hand to help stabilize his leg and the vein.
Easy, bud. Good boy. Good
Going
boy,
in as distal as possible so that we can reuse that vein if necessary. Using my left hand to stabilize the needle and then pulling on with my right hand. And so I only need 3 mils for the video, but we are just doing a T4 TSH. It is flowing slowly, but it is flowing, so that's good. We just might not get our 3 mils.
Don't move.
You're okay.
And just gonna pump his paw a bit with my right hand to increase blood flow.
Easy, bud.
Just being a good boy. It's hard to sit for this long, so whether we'll get the 3 mils or not, it's debatable. He's being good for us. And so this will just be going into a red top tube. We don't need to fill our purple tube. And then I would be labeling that with the name, date, what it is, and afterwards, checking to make we'll be holding up. So I'll go to pull the needle out by putting my thumb over, asking her to stop occluding, and then pull the needle out. That way we don't give him a hematoma, and then we have a bandage to put over it to help keep pressure on his leg, which we can either remove ourselves or we can ask the owner to remove when they get home. Do you think it's still flowing?
Seen a couple of drops
Okay.
in your syringe there.
Sorry guys, thank you for holding. Jugular is faster, but for this old guy, this is better. It's less stressful for him.
Yeah, it's definitely still coming.
It just takes longer.
Easy, bud. Easy. Easy.
It's okay, good boy.
Almost done, bud.
Our assistants are being awesome. Assistant and tech. So it's nice steady pressure, that we were not collapsing the vein either. I think that's it. Hey?
Yep, that's good.
Perfect. So I'm placing my thumb over the needle, and Jen is going to stop occluding, and I'm going to remove the needle. And that's how you do a lateral saphenous blood collection on a dog. Thank you. Oh, I guess you can keep filming. I'm sorry. Can you hit film?
No, it was still
Oh,
filming.
okay. So I have to do my cleanup, and so this will go in the tube, red top tube. It's just free T4 and TSH going into the red top.
Yeah, Oscar got jumped by a couple guys who was out there.
And we have another dog that needs help.
Is that Oscar from
So, put a sushi on his leg so that these guys can get going and helping that other dog that needs help. Perfect. He's fluffy, so it's not completely ideal, but that's okay. Perfect. He's good. And then this stuff goes in the garbage. Our sharps goes in the sharps bin up here and garbage. And I'll be putting the rest of this in back where it belongs, labeling this with name, date, what it is. And that's how you do lateral saphenous blood collection. Thank you. Hi, my name is Tara Talbot, student number T007-45663. My clinic mentor, Gwen, an RVT, and my other restrainer, Honey. She's our manager. So I'm going to be doing a medial saphenous blood draw on our kitty cat Sasquatch here. So we already pre-shaved the area and put EMLA on it. That way it's nice and comfortable for him. So I'm just gonna wipe off the EMLA with some alcohol first.
Perfect, yeah. And I only, I filled 50 tablets. That was just.
And then put more alcohol on. It helps visualize the vein and also disinfects the area. So I have a 23 gauge butterfly needle here. And my 3 ml syringe. And so for our kitty cats, we want to get about 2 mils if we can. More is better, but so I'm going to use my hand to help stabilize the leg while Gwen occludes with one of her free hands and then pulls back the other foot with her other hand. So I have my bevel up and I'm going to go in.
Good chin scratch. Good.
So we've got a flash there.
Good boy. It's okay. You gotta be patient. It's okay. Good boy.
It's okay, Mama.
Good boy. Good boy. Such a good boy.
Nice flow, so I'm blowing slow but steady. That way we don't collapse the vein. He is a good boy. Very good demo cat. We knew the black cat would be good luck.
Good boy.
So it's still flowing nice and steady.
It's okay. You're okay. You're a good kitty. Good boy.
I know. I'm sorry, Sasquatch.
Good boy.
Hi, Mamas.
Good mama. You're a good boy.
He is a really good boy.
Beautiful eyes and your beautiful feet. Such a good boy. Good job, Sasquatch. It's okay.
A few more seconds, but
Okay. Good boy. A few more seconds.
so just gonna
More seconds.
almost got our 2 mils.
There we go.
It is slower on this vein as it is a smaller vein than jugular, but
What a good kitty.
perfect. We got our 2 mils. So Gwen is gonna stop occluding. I'm gonna get her to place her thumb over the opening and take the needle out there.
Oh, it's okay,
Perfect.
buddy.
And so with this blood, I would put it into the EDTA and into the serum separator tube, a mil into each tube, but we're not running it today. We did get permission from the owner to practice, and then I would put the name, date, and what the blood is for. And then after a few minutes of holding off, we would check to make sure he doesn't have a hematoma. We can also put a bandage over that to help prevent any bruising. He's a very good kitty.
Good boy, Sasquatch. Oh, not the dreaded bandage.
Yes,
Goodness,
perfect.
that's the hardest part.
And then we can check on that later and remove the bandage. And that's how you do a medial blood draw on a medial saphenous blood draw on a kitty cat. Thank you.
Good point,
Okay.
yeah.
So we're gonna put the blood in. We've decided to run the blood. So a mil into this tube first to help prevent clotting. Good. Oop. Blood all over the marker. Tilt it gently to help mix. That way it doesn't clot. And then the rest can go into our serum separator. Perfect. Yeah, label with a permanent marker, name, date, and what the blood work is that we're running. Thank you. And then for cleanup, sharps go into the sharps bin over here. And then all of our garbage goes right here, and we empty that into a bigger garbage later. We're keeping him out for surgery, but If we had another patient, I would remove the towel and spray the entire area with Prevail and wipe that up. But we're gonna keep using this towel for his surgery. And that's how you do medial saphenous blood draw on a kitty cat. Thank you. Talbot, student number T007-45663. This is my clinic mentor, Jen, and our patient, Maisie. She's getting spayed today, doing pre-anesthetic blood work. I'm gonna be doing a jugular vein blood collection. So I have my 3 ml syringe here and a 22 gauge needle. She is a bit nervous, so we'll see how this goes. I do have clippers if I need to shave, and I have alcohol here. So she's gonna be holding her muzzle, and then also holding her chest and legs for me. So I'm gonna occlude the vein by putting my thumb into the jugular groove, and hopefully we can feel the vein pop up. I think I feel it there. So I'm gonna wet the area with the alcohol. It disinfects the area, but it also helps visualize that vein sometimes, makes it easier. So I'm gonna go bevel up, back in the jugular. Sorry, so I'll make sure I can feel it. And then at a 30-degree angle. Got a flash there.
Good girl. Good girl, Maisie. Good girl.
I know.
Good girl.
Well, I got a flash, so
Good girl.
it's okay. I'm trying, girly. If you think she's too stressed, just let me know.
It's okay.
Any tips? Oh,
Thank
I
you.
got it actually. There we go. Now, slow and steady pull back. Want 3 mils, it's optimal. With a steadier hand, this would go better, but I'll get that with practice. So it makes a difference moving by just a millimeter. Perfect, I got my 3 mils. So I'm gonna stop occluding, and I'm gonna hold off, and then Jen is gonna take over holding off. Cap my needle. So I'm gonna put a mil into here. Into the EDTA tube. We're doing this one first, that way it doesn't clot. And I'm gonna tilt it gently to help mix it up, prevent clotting. And then the rest can go into the serum separator. Got a nice sample, which is awesome. So for my garbage, needle goes into sharp. This goes in the garbage here. Didn't need my clippers, which is awesome. And then label both tubes with the date and her name. And you can also put what it's for, so it's pre-anesthetic blood work. And then we're gonna also check the area to make sure she doesn't have a giant hematoma forming on her neck. It's still, it looks like it's done bleeding and there's no bruising. And we'll check on that again later to clean it up if we need to. And that's how you do a jugular blood collection on a dog. And if we were done with her, I would also disinfect this area with Prevail and wipe it down with paper towel. And thanks for watching. My name is Tara Talbot, student number T007-45663. This is my cat, Kraken. I'm gonna be doing a jugular blood draw on him. And my restrainer is Ashley, also a clinic mentor in RVT. So we've already shaved his neck area and put some EMLA on it, just to help have him not jerk back. He's also on GABA and on Traz because he's a wiggly boy. So I'm gonna alcohol the area somewhere. Disinfects the area and also helps part any remaining hair. So I have a 3 ml syringe here and a 22 gauge needle. So my restrainer is going to be holding his head, and then I'm not going to drop needles on the ground. I'm just going to be holding his head, and then with her other hand holding his front legs. Hopefully he's cooperative for this. I'm going to place my thumb in jugular groove. Sorry, Ashley. To help pop that vein up. If he's being too difficult, just let me know. And bevel up. Okay, yeah. Sorry.
If you want to hold her feet so she doesn't stretch my eyes out.
Excellent, you don't need your eyes.
You got, I was gonna say, you've got PPE on.
Oh my god. These. Okay.
Is this a cat that hates having air blown on their nose or loves having?
I don't know. Okay. It's fine. I've got it. There we go. So nice and steady. I don't got the steadiest of hand.
It's all right.
I'm shaking. Oh,
Deep
I
breath.
think
Everything's all right.
it's blown a little. There we go.
You're doing great.
Thanks. I'm shaking. It's because I've done it so many times. I think Kraken likes you. I'm just gonna readjust my hand a little.
Mhm.
You're okay. He just needed a nose bleeper. I'm almost at 2 mils. Oh, and pull out.
Well, all we need is a CBC, so that's enough.
Yes. So that's how you do a jugular blood draw on a cat. And for cleanup, my sharps go in the sharp bin here. I'm gonna be.
How hard would you cry if I said I wasn't filming right now?
Are you filming?
Duh. You're fine.
I'm putting that in my video. Just so you know.
Sorry, that was a mean CM thing to say.
Oh. Okay. I'm gonna rock this gently. Rest. So I put 0.75 mils into each tube, so that's all I got. I label with his name, date, and what it's for, and then the rest of my garbage into this bin. And once we put the cat away, the towel goes into laundry, and I wipe this area with Prevail and wipe the area down, and that's how you do a jugular blood draw on a cat. Thank you.